Sam, I'm going to be your nurse today. I've seen you've been going to support group for 2 months and had treatment for depression. How would you say that's gone?
I think they're going well. I feel like I've built a good support system there, and they've really helped to educate me about depression and how to manage it.
That's good to hear. While we're here, can I ask you a few questions about smoking and tobacco? They're standard and we ask everybody.
Yeah, sure. I smoke. What do you want to know from me?
Um, just how much you smoke, how often, like daily. Um, there's been a lot of information about like health risks.
Sure. Could you tell me more about those health risks?
Yeah, smoking can cause shortness of breath, trouble doing physical activity, and asthma, just to name a few.
I seem to have experienced all of those. I know that they probably come from my smoking, but it really helped me cope with my depression. Trying to quit's been a hard topic for me to approach.
Yeah. Maybe we can find other things to take its place to help you relax and cope. So, do you use tobacco products?
Yeah, I do. I smoke a lot, actually.
How often do you smoke?
I'd say
Or how much per
probably
day?
2 packs per day.
What kind of cigarettes do you smoke?
They don't have filters in them.
Okay, so you smoke about 2 packs a day without filters?
Mm-hmm.
Okay. That's over a good limit, and I'm kind of concerned about your tobacco use, especially with your asthma. It'll only make the problem worse, and smoking causes you to take in less oxygen, and so everything in your body runs off oxygen. So it's just kind of concerning. So when did you start smoking?
I started smoking when I was 14. Some of my friends kind of convinced me to do it, so.
And you smoke. So you started when you were 14. So it's been about 10 years.
Yeah, and I smoke 2 packs a day.
Okay.
Every day.
Like I said, with the short-term consequences, it can also cause heart attack, stroke, and cancer. Is there any reason you might want to try to stop?
I know I probably should, but right now it's better that I do smoke because I'm just so depressed, and I feel like smoking is what I can rely on to relieve that stress. I do have a 10-year-old niece, but my brother won't let me smoke around her, so I guess that helps when I'm with her. So maybe if I see her more and spend more time with her, that'll be good motivation to help me.
So you enjoy spending time with her, but you can't because you smoke?
Yeah.
It sounds like she really looks up to you, and time with her would be beneficial, I think. And you also said you don't think you can stop because it's kind of helping you get out of this depression?
Yeah, it seems to be helping me.
Okay. Secondhand smoke with your niece is also very dangerous, and she can be exposed to the chemicals. Your brother doesn't want you to be around her because she would get an increased chance of lung disease and heart disease. Are there any other reasons you'd want to stop?
I like doing outdoor activities, and I like to go hiking and biking, but obviously smoking makes those things hard since I have asthma now.
Mm-hmm.
So.
So you want to be healthier so you can do those things outside?
Yeah, I think that's something that's important to me.
Those things sound like great stress relievers in themselves, and if you replace smoking with those, that might help relieve some of the stress and help you stay out of the depression state that you were in. What are reasons you don't want to quit?
I just really enjoy the way that a cigarette makes me feel. It just makes me feel relaxed and
Yeah.
kind of takes my mind off things.
Anything else?
I don't know. I guess I worry if I stop smoking that it'll make my depression worse.
Yeah, that makes sense. You have been really successful in overcoming your depression, so I think that's an encouragement for you to maybe try to stop smoking. You have that behind you, and you've overcome that, so I think you'd actually be able to overcome this. So you've been successful in overcoming depression. Why do you think that quitting smoking would cause you to maybe relapse?
Well, smoking just really makes me relax, and it takes away the feeling of anxiety, and it calms me down. So I feel like not having that cigarette to rely on would cause me to be depressed again because I wouldn't really know how to manage it that well.
There are small steps that you could take to achieve any goal, but I understand why that's intimidating for you. You've overcome a lot, and you don't want to lose any progress that you have made. What are the good things about quitting?
Well, I guess I'd be able to spend more time with my niece, and it would, I guess the support groups I've been going to could help me to
Yeah.
wean off of them, but
What
I'm
are
just nervous how it'll be hard to avoid relapsing again.
So what do you think the pros are for continuing to smoke or not quitting?
Well, I would say that, you know,
Just the same
something to
thing.
rely on.
Yeah.
So it helps me relax, calms me down, and it's just something like a little escape I can go to.
Yeah. So what are the biggest cons of continuing to smoke?
Well, I guess I kind of smell bad when I smoke because cigarette smoke doesn't really smell the best.
Yeah.
I can't really be around my niece as much as I would like to. My asthma could get worse, or I could get one of those diseases you were talking about earlier.
Yeah. Do you have any history of a family disease from smoking or any history of smoking in your family?
Well, I guess my dad would be the only person that would be affected by that because he died at age 66 from cancer. So I guess that would only be the disease that I could really think of.
Mm-hmm. So that's kind of scary because you don't want that to happen to you.
I guess I get sinus infections a lot too, so I guess that could be related.
Yeah. It sounds like you know like the health risks and your health is important to you. Are there any more reasons for you to continue at this time?
I mean, I think there's some, but
Can I offer some advice?
sure.
Maybe you could try to, or maybe you could try to surround yourself with your brother and your niece more often, and you could try to stop smoking. And if you're around them more, it'll be easier to stop.
Yeah, I like that idea. I feel like that would be a good motivation. I just don't think I could cut down completely right away. Maybe
Mhm.
if I take it slow, day by day, and see. It just really makes me nervous.
I understand why that's scary, and you've been so successful, and you've showed that you have the ability to stop, um, or you've shown the ability to overcome depression. So I think that you would have the ability to stop smoking if you made that decision. From 1 to 10 on this ruler, the readiness ruler, how ready do you think you'd be to stop?
I think probably about a 6.
A 6? That's pretty good. What are the how ready? So that's the out of 10. That's how much you realize that you should make a change. How ready are you to make that change from 1 to 10?
I'd probably say a 3.
A 3. It sounds like there's a little bit of you that wants to see a change. Is there a time that we could schedule a follow-up appointment in a couple months so I can see how you're doing and we can talk about it more?
Yeah. How about in 2 months? That would be good for me.
Okay. Until then, just try to surround yourself with your niece and your brother and don't smoke around her and see if there's any changes that just happen naturally because of that.
Okay, sounds like a good plan to me.
Thanks for talking with